Hi, we're here with Samantha, and we really just sort of ask one question, or we might ask a couple more, but we're going to ask the main question, which is what's one thing you want clinicians and or researchers to know about people challenged by pain?
I think one thing that's really important to consider is that pain isn't just a physical process. It is emotional, it's mental, and it's social. It's a social process that a lot of people don't recognize. There's a lot of barriers that aren't talked about, and a lot of accessibility needs that, frankly, aren't being met right now.
So that's really interesting. Could you talk a little bit more about that social aspect? That's a neat space to consider.
Yeah. I think when I think about social, I think about social supports, such as family, friends, support groups. These are so important, and they're not talked about a lot. There's a lot of research, a lot of clinical work on individual therapy and individual spaces for helping, such as medications, but there's not a lot of talking about how communicating with others can actually help people, and how connecting with others is really important to have a shared experience and feel heard and not alone.
Awesome. Thank you for sharing one thing. And if I can, I'll ask another question since you're also a researcher.
Yes.
So what's one thing coming kind of from your research work that you want other people who live with pain to know about the kind of work you're doing?
I want others to know that in the work that I do, I study endometriosis, and it's typically looked at as a gender disease, and it's really only studied in cis women, but a whole spectrum of folks experience this disease, and so I think we need more research, we need more knowledge on this disease and how to really connect folks and help them deal with the pain of living with endometriosis every day.
Yeah, great. And so that's what your research is focused on?
Yes, I look at disability identity in sex and gender minority folks with endometriosis.
Great. Well, thank you so much for sharing your one things. We really appreciate it.
Thank you so much.